younger than that, and including our younger generation, including our kids, okay? Some topics will be uncomfortable, and that's fine. That's kind of our jobs. We talk about those hard topics, okay?
Okay, and for the younger people who are less than 40 years, that is the time that you build your foundation so that when you're getting to the age of 60, okay, we call you seniors who are 65. That just doesn't mean that you let your body be a senior. You need to keep your body very youthful, and that's why you need this preventative services. So for younger people who are less than 40, it's now the time to lay the foundation to take care of your body at this point. And the biggest thing that you'll find here is that preventative services. I can tell you a majority of my patients, more than 80% of patients that I have, they didn't come in because they were coming in of a chief complaint. And two of the biggest diseases that we see, especially here in the United States, is diabetes and hypertension. Those two things are silent killers. In fact, we call them silent killers because you'll never know you have hypertension until you either have a heart attack, you have a stroke, you have a kidney failure. Those are the three things that usually people come in later on after the disease has progressed too much. And so it's very important that you start looking at those kind of things before it's too late. And so some of those things that you can do at home is checking your blood pressures. How many people have a blood pressure cuff in their home? Okay. So a good number of you guys have a blood pressure cuff in their home. How many people have a medicine cabinet with more than 3 medications?
Including Tylenol.
Tylenol, cough syrup, aspirin. A lot of people have that. And so you see, we tend to kind of put a Band-Aid on what is going on. You'll take Tylenol for the headache, you'll take aspirin because you think, oh, maybe I don't want a blood clot. But in fact, you didn't go take a look at what happened for you to get that headache. Because a headache is just not a headache. There's so many types of headaches that you can suffer from. And most people will say, oh, I didn't sleep, so yeah, I have a headache, and you just let it slide, take some Tylenol, and it goes away. Like a Band-Aid, it's going to prevent that bleeding. Like a Band-Aid, it's going to prevent you from getting severe headaches. But did you actually take care of the cause of that headache? No. You just put a Band-Aid on it. And when it comes back more severe than it was before. And so some of the preventative services that we offer, especially in primary care, and this is why we are here, is the screening such as colon cancer. This is one of those uncomfortable screenings that people don't want to go to. Anybody who is above 45 qualifies for screening for colon cancer. And a lot of people will say, this is one of those uncomfortable procedures that I don't want to go through, but if everything comes back fine, you have 10 years to recover from that procedure before you can get it again. But if you don't do that and you go to the point where it's so far much gone, you can die from it. I'll give you a good example. I had a patient who came in, and he was older, around 75, and usually screening of colon cancer ends at the age of 75. And he said, oh, well, I have these hemorrhoids, especially with women who have given birth. That's a very common thing that people tend to complain about. I had some hemorrhoids, so yeah, I get some streak of blood in my stool, but nothing big, comes and goes. Or I have constipation. Constipation, first of all, is not normal. So if you get constipated or you get diarrhea, that's not normal. That's your body telling you something. And so he comes in and say, it's not a big deal. And then he used to smoke as well, like in the past. But he hasn't smoked in a while. And so he goes, yeah, and maybe mild abdominal pain. You know where we say, oh, my belly, imenichuna hapa kidogo, but that went away. And so we did some screening tests. One of them was colon cancer screening. And this guy had 8 centimeter big that we couldn't get the camera into the colon. And then looking at it, he also had an aortic aneurysm. That's where so we have blood vessels, and aorta is one of them for those who have done biology. And it goes, it's not just in the heart, it also goes to your abdomen. And his was so swollen to the point where it was just almost rupturing. He had to get 2 surgeries within a month to treat the aneurysm, but also to take the colon cancer out. What am I trying to say? Stop ignoring those small things that you see that's normal. You're constipated, so you think that's normal. It's not. You need to take those kind of situations and just go see someone. Because there's no harm in going and they tell you everything is fine, you know? Other than waiting until it's too late for you to get that treatment.
Tagging on that, so I had you guys lift your hands. Greater than the age of 45 in this room, how many people have had a colonoscopy? Okay, so that pretty much makes up about half of the group we have here. So I will call you guys out. What is preventing you? Anybody with an answer? And this, yes?
Yeah, there's this test that we are doing in the lab instead of the colonoscopy. Is that effective?
Yes, so the question here is the screening on itself. So I asked the question about colonoscopy, and yes, there is another test. We call it the FIT test. We also call it the Cologuard, that is usually done through the lab. Is it effective? To a point, yes. And it's not as accurate as the colonoscopy itself. So I will explain the difference between the two of them. When you do the Cologuard, technically what you submit is a stool sample, and we test for DNA that looks for any DNA dysfunctions that will correlate with colon cancer. When you're doing the colonoscopy, you actually have somebody with a camera in your colon actually looking at the colon itself. And better off, if they do find any sort of what we call polyps that eventually develop into colon cancer, they take them out during the procedure. So it's pretty much, if I draw a coin, I will hit at somebody, that's the Cologuard. But if I'm targeting a specific person, I can walk to that person and touch them. And that is the colonoscopy. So point to say here is if you are going to get colon cancer, we highly recommend that you go for the colonoscopy itself. But if you cannot, either for a good reason or for excuses, because we give plenty of those, then the Cologuard is your next best choice. Okay? But of course, we want you to go for the gold standard. Now, here's something to know. Colon cancer, because that's where we started, the colon cancer stage 1, which is why we said people for colonoscopy, in the absence of symptoms. So the only qualification is for you to turn 45. That's the only qualification. When you go in, we are not really trying to treat anything. We're trying to find whether you have it or not. If you do not, well and good, we'll look again in 10 years. If you do, if we can catch it at stage 1, you can have a normal life. If we catch it at stage 4, now that's where you find somebody with a small bag here. Because their colon, sometimes we actually have to resection. Resection is technically take a part of it that has the colon cancer, so you lose, you pretty much lose the function of the rest of your colon, and now you have those bags that go here. Now, I know a lot of us work in healthcare. Have anybody seen somebody with an ostomy or ostomy bag? So you can almost guess that somebody had a problem with their colon, more likely than not, some form of cancer. So when you're thinking about whether you want to go through the colonoscopy or not, that's pretty much what you should be looking at, is do you want to be that person? If the answer is no, go get your colonoscopy, whether or not you have symptoms. Okay? All right. Yep.
Okay, so the other screenings, I think everybody received a sheet like this one here. And if you go through it, you can see everything that's required. So on this side here, it tells you what screening it is. In the middle, it tells you what age qualifies for that screening. And then at the end, it just tells you how many years, the frequency that you should get those screening. The other thing that we need to talk about that is the biggest, cancer, or the most common cancer, is breast cancer. And that is something that any women or any woman needs to think about getting a mammogram. It's uncomfortable, yes. It's not something that everybody wants to go through, but it's something that can be prevented, or at least something that you can catch early. So for breast cancer, we can see anybody who is above the age of 40 to 75. You qualify to get a screening with a mammogram. And so if you don't have to have any symptoms. Again, all this that we call screening, you do not need to have any symptoms. Screening just means that you qualify for that based on your age, your gender. The other thing is vaccinations. I know there's a lot of controversies about vaccinations, and I'm not here to tell you what the controversies are. I'm here to tell you the medical reasoning and to give you the facts about it. Everybody here has taken an antibiotic, has taken a supplement, has taken other medications. Do you actually know the components of those medications? Did you go into details and knew what molecular component is that in that medication? Now, I'll tell you, a lot of vaccination, before they are approved actually to give to human beings, they have to go through a lot of scrutiny. FDA does not just allow anything. And that's why we have supplement, and if you read on the supplement, it tells you this is not FDA approved, or it has not been evaluated by FDA. Because there are specific rules and guidelines and protocols that has to go through those vaccinations for them to be put into the market. And as we all know, there was, just like anything, there's the pros and the cons. You might get an allergic reaction to just about anything. And that's the same thing with vaccination. And I know there's a lot of misconceptions about COVID vaccine and flu vaccines. And if you've had an allergic reaction, by all means, that's not something for you. You can take an alternative or you can stop taking it. But when there is no contraindication or there is no reason not to take it, we say preventative medicine is much better than curing the same condition. And so in regarding to vaccination, we have COVID vaccine, we have flu vaccine, which is yearly. And then for the younger people, we have HPV vaccine. And this is a controversy as well that I've had, especially with younger parents. They think that if they allow their kids to have HPV vaccination, they're allowing bad behavior. But here's the thing. You don't give them that HPV vaccine, they bring you cervical cancer. So you get to choose. Because HPV is what causes cervical cancer. And this is the only cancer that is preventable. The only cancer that is preventable is cervical cancer, because the number one cause of cervical cancer is HPV. And so a lot of parents tend to say, if I give them HPV vaccine, I'm allowing them to go have sex with everybody. That's not the case. Because if you are preventing it at that time, then later on, you're not going to deal with cervical cancer. Albert, do you have a question?
Yeah, I had a dentist about my age, a man, and he had breast cancer.
Yeah.
My question is how it seems like that is rare. Is it rarely rare?
Having breast cancer in men is actually not abnormal, because we all have breast tissues. It's how big they get. For women, they get bigger than for male because of you guys have androgen and testosterone more than we have the estrogens and progesterone. And so it's not abnormal, because people tend to have different amounts of the hormones in our bodies. And so someone like him probably had more estrogen, and estrogen is the number one culprit. And that's why we have progesterone to counter the effect of estrogen. And that actually is a good question because we also get to women where we are postmenopausal. And so before you agree to take that estrogen pill, because the hot flashes are too bad, the night sweats are too bad, you have to talk to your doctor about what are your risks. Is there a family history of breast cancer? Have you ever had breast cancer? Because if that's the case, then you need to have estrogen with progesterone together for the menopausal symptoms. And so with him, he probably just had more estrogen in his body, and that affected him to the point where he had breast cancer. And the other thing is we tend to tell women that they need to do breast exam. That's not really recommended anymore to do breast exam. But if you see anything that's abnormal, you see a lump, your nipples are inverted, you see any like orange color, you need to go see someone so that you can get tested for it. This is both male and female, not just females.
Or they're lactating.
Yes. Because that could be one of the reasons probably you have too much prolactin. That's also another hormone that we produce. And so if you're lactating, whether you're male or female, at any age and you are not breastfeeding, then you need to go check for that.
Tagging back on that question, when it comes to the screening guidelines for breast cancer, as you may see in that paper, male are not included in it. And yes, it is true that breast cancer is more common in women than men, but like Dr. Monica mentioned, it does not mean men cannot get it. So the point to note is if it looks abnormal, it is abnormal until a qualified medical provider tells you that it's nothing to worry about. Okay? And on that note, women in the group, how many of you who are older than 40 are up to date with their mammograms? Yeah. So half the group. And the same question will go in that you think about it in terms of what is holding you back. And if you have any specific questions that relate to that, let us know. Now, the question about vaccines, one of the biggest excuses I get in primary care actually have to do with religion, in that me and my pastor, we're going to pray about it. You know, God will prevent this thing from getting us. So your pastor is right there, and I know him. So I will ask, just put you on the spot, have you told people not to get their vaccines? No. No. Mm-hmm.
It's okay. Everybody should go for vaccines. If you are sick, go see your doctor. If you are given medication, please take them and pray before you take them. It is still faith. So whether God heals you through the medication or gives you divine healing, please do what you have to do. Nobody should be foolish.
All right. Yeah, thank you.
And talking about praying about it, one thing you don't know is that you don't get sick because you're capitalizing from everybody else. There's something we call herd immunity. When 5 people are immunized and I'm not, I'm being with people who are immunized, so chances of them getting the disease and it being severe enough for them to be able to pass it to somebody else is very low. And so you are saying you're praying about it and you've never gotten it, but what you don't know is you should be thanking your neighbors because they got it on your behalf. And they are protecting you. Yeah.
And you protect others by getting it yourself, because 5 vaccinated is probably better than 4. Now, another topic that Ukeda mentioned here, so it's projected on that screen, I think it's, where is it, diabetes? It's about midway down, diabetes. That is something that I want to place a little bit emphasis on, because that is the elephant in the room in our community. So let me put it this way. I do have a lot of patients within the clinic and within our community. And by community, I mean just within the Kenyan community. And yes, Dr. Albert, you're also Kenyan. I mean, Albert, you're also Kenyan. You're part of us. But within people who have immigrated from Kenya that I've seen in the clinic, 80% of them have diabetes. Now, that is important to kind of put in perspective. In Kenya, by the time you left Kenya, how many people did you know that have diabetes? It's very rare in Kenya. So what changed when we migrate here? And now that is the monster that we need to tackle in terms of several things. One of them was how many people have actually gone to a doctor for any reason, and especially primary care. I would tell you, except for one or two, all the other patients that come to the clinic, they do not come to the clinic because they have diabetes. They come because, I fell down, my foot hurt. I was at work, especially a lot of us work in healthcare, I injured my back. And we're like, let's screen you for ABCD, and that's how we capture diabetes. So let me put this in perspective. What is diabetes? It's a disease of elevated blood sugars. Where do they come from? Two components that we're very bad at. And one of them is our diet, in exercise. We do not exercise, but we eat very unhealthy. So let me call out a few diets that we are very fond of. Ugali. How many people like ugali? Chapati. Mandazi. Yeah. I should know. I saw you eating one. So the issue that comes in question here is that these are our staple diets in Kenya, and we consider them healthy, but there's a couple of things that change. Where do we get our food from Kenya most of the time? We get it straight out of the garden. It's organic. How do we get it from the garden? You go there and dig it out yourself. You want ugali? Fine. You go, you plant the corn, unalimia, you harvest, you carry it all the way to the posho mill, and then you bring it back. By the time you're having that diet, you have already exercised enough for it. True or false? Okay. Simple things. What does it take to, I grew up in Nyeri. What does it take to even get a shower? You go down to the river, you carry the water upstairs, you go put it under the sun before you take a shower. The difference is the foods that we eat in Kenya have minimal impact because we exercise a lot. Everything is exercise in Kenya. Even to catch a matatu, you still have to walk to the stage. You want to go visit your friends, you walk. We do not do that here. So we have our cars straight in the garage. We go to the door of the shop, we get in, we buy our ugali, we go home, and it's ugali and Netflix. And that is, that is where we are failing ourselves. So how many people within this group here exercise, do any form of exercise? Lift your hand if you exercise. What exercise do you do? Walk. What exercise do you do? Run. I saw somebody else. What exercise do you do? Hiking. Now, when you go walking, how often are you walking?
Maybe twice or three times a week.
Okay. 2 to 3 times a week. So a recommendation when it comes to exercising is actually about, at minimum, 40 minutes, minimum 3 days a week. Now, some of the excuses I get from within our population in terms of, do you exercise? Yes, my job is very difficult. When you work as a CNA, you are going to walk back and forth. If you work in a warehouse, you walk back and forth. If it's at work, that is not exercise. That is your job, okay? Exercise is intentional or deliberate activity outside of work, okay? And we know that because the greatest majority of these people who we get diabetes in do quote unquote exercise, but of course we know it's not sufficient. Now, talking about the effects of diabetes itself, it's treatable, and especially if we capture it before it gets bad. But let's talk about what happens when it gets bad. So I will tell you this as a case within my clinic. A patient gets sent to me from the emergency room, and they went to the emergency room because of an injury. The blood sugars, they always check them, were significantly elevated, more than 600. Normal blood sugar is actually less than 100. So they sent them to me. We check their A1C. Who knows what an A1C is? One person. Become very familiar with A1C. We'll talk about it a little bit more. We check their A1C, significantly elevated. They have what we call uncontrolled diabetes. Not to say just that they have uncontrolled diabetes, but within 1 week, this patient was on dialysis because they had had diabetes so long that it damaged one of the vital organs, your kidneys. When kidneys are gone, they don't come back. They're one-way street. Now, for that particular patient, it was just the kidneys. Heart failure, how many of you know what heart failure is? 2 people. Heart failure is pretty much where your heart cannot function enough to actually circulate blood within your body. Now, if you come across people who have swelling on their legs, please tell them to go get checked for that. It could be happening, especially if they've not seen a doctor, but it's a limitation of circulation within your body. Eyes, how many people wear eyeglasses here? A lot. If you wear eyeglasses, you have bad vision, you have not seen a doctor. Is it diabetes damaging your eyes? Could be, because it will turn you blind if it stays uncontrolled for so long. Wounds, you know, we talked about ugali, and you're cooking your ugali, katakata skuma, you slice your finger, and it has not healed 2 weeks later. Go get checked for diabetes because it will affect your body's ability to heal. You go to work, everybody at your work has COVID, everybody gets rid of COVID. You are the only one that 2 weeks later still has that COVID. What's going on? Your immunity. Go get checked for diabetes, okay? What does it take to check for diabetes? Walk into a clinic, say you want a physical exam, we screen everybody. You catch it early, you treat it. Do not be the person that by the time you come to see me, we are talking about dialysis, heart failure, and losing eyes and things like those ones. Okay? Yes.
At that point, I come and you find out that I do have diabetes. And what I have had a lot of times is somebody says, they give me this medicine, metformin, but I decided I'm going to control it with diet. Can you address that? Because that is the biggest challenge we have in our community. I'm going to control it.
So let me address this question this way. So first of all, when it comes to diet, we tackled the topic of our own staple foods are not very healthy in this environment. So when we're talking about what is considered a healthy diet, it's a very different question than just saying I'll eat small ugali or something like that. When we are talking about a healthy diet in relevance to diabetes, it's more of diets that are low, very low in carbohydrates and fats, more in what we'd call vegetables. So think about it this way. On Kenyan community, in your plate of ugali, which one is bigger? Is it the ugali or the skuma? So that's the first thing we talk about reversing there, because that's probably the genesis of the problem. But to answer your question, so when you're talking about A1C, so A1C is a number that what we call pre-diabetes. Pre-diabetes, risk of developing diabetes, it goes from 5.7 to 6.4. Now, that would usually correlate with blood sugar. So we talked about normal blood sugar is less than 100. Pre-diabetes blood sugar will correlate somewhere between 100 to 120-ish on average. The actual medical number is 128. 6.4 is greater than 6.4. That's when you diagnose diabetes. And that number goes all the way high to 15. When it hits 15, the machines cannot measure it. What that technically means is your blood is technically syrup. You know the syrup unaweka kwa pancake? That's pretty much how your blood looks like. When your A1C is greater than 7, most of the time we will recommend medications. It does not mean you can't control it with changing diet, but most of the time we'll recommend start a medication, change your lifestyle. We'll talk about stopping the medication later. When your A1C hits 8, most of the time you will be on a medication. Between 7 and 8, sometimes there can be a negotiation depending on the patient, how much changes the patient is willing to make. When you are hitting anything greater than 8, now that's kind of your danger zone. Also, we'll start seeing a lot of the side effects in terms of kidney failure, heart failure, retinopathy, losing your eyes, and and losing your feet. So by the time we are hitting 8, it's no question. A lot of times 9 is the juncture where you start hearing questions about insulin. And are you guys familiar with insulin? So insulin is pretty much to help you absorb your blood sugar so that they are not, too much of it in your blood. So by the time you are hitting around 9, most of the time you will hear us talking about insulin. Now, a lot of times when we are talking about starting medications, including insulin, it still does not mean you should not exercise. It still does not mean that you should not change your diet. The goal is never to have you on insulin forever. As with any other condition, the goal is never to have you on medications forever. It's pretty much allowing us to control your condition before they damage anything at that point. Does that answer your question? Yes.
I was actually looking more towards the compliance. Because and the reason I'm very much up to diabetes and high blood pressure is because my community will say, I doubt that doctor, I doubt their machines. I don't think I have it. I think I was having a stressful moment. I think I had taken tea with so much sugar. You know, we had taken chapati and what before they do the, and we have all these reasons. And that is something, one of the D's we were told this morning called denial. It's okay to be in denial before you actually agree, but this is what I'm gonna say. In the Old Testament, it was the priest who would determine that you're sick and send you out of the camp. Then after the 7 days, the same priest, you show yourself to the priest, they say, you are now good, come back into the camp. The doctor told you you were sick, wait for the doctor to tell you that now that you're well. If you decide to go the way of managing with food and whatever, don't go manage with your auntie, with your neighbor, with your cousin, with your doctor who is in Kenya. Please go to a nutritionist or somebody who is professional that they can help you through the journey. I'm saying this from the challenges I have dealt with in our community.
Yeah, so thank you for adding to that. A lot of times when a patient has a new diagnosis of diabetes, we always send them to a nutritionist to talk about that specific question about diet. We also set required follow-up. So A1C measures an average of blood sugars over around 3 months. So if you had sugary, even if you ate a bag of sugar that morning, it's not really going to affect your A1C. About compliance, like Dr. Beatty said, compliance is extremely important because that's what allows us to measure whether or not we are controlling the condition or not. Usually, with new diagnosis, it's about every 3 months. And compliance has a lot to do with the patient themselves, that's you guys, taking responsibility on your own life. I am not going to come to your neighborhood to see if you're walking. I will not show up behind you at a restaurant to check that the size of your ugali. That is on you. So keep in mind that in as much information that will give you, the responsibility is squarely on you. Yeah. Yes.
Okay, and then, so that's about diabetes. Any questions on the diabetes screening, medications, compliance? Okay, so the other big monster that we have to deal is called hypertension. When we were talking here, a lot of you guys said you had your blood pressure cuff. And for the most part, if you don't have any diagnosis of hypertension, you don't really need to check your blood pressure. But if you do, then you have to be compliant and check blood pressures every single day because, to be able to take your medication. And so what is hypertension? Hypertension just means high blood pressure. And again, like diabetes, the biggest thing that brings people to the clinic, especially you men that I'm looking at, do I say what brings you to the clinic? Erectile dysfunction. That is the biggest thing that brings men to the clinic when they have diabetes and hypertension. And the reason why I'm saying that is because I get patients where they're hiding, they're like, can I get a Viagra? No, you need to control your diabetes and hypertension.
And they don't want to see her, they want to see me.
Yeah. And so for the Kenyan community, we really have that trouble because a lot of men don't talk about their sexual health. They do not. And so when you see a Mwangi and that's your problem, you don't come to see a Mwangi. You find an Albert because they won't know you. But one thing that we need to know really is discussing those kinds of uncomfortable things that really affect the people in our community. And as I said, hypertension is a silent killer. A lot of people don't know they have hypertension until one day you go to the hospital because of stroke, and then they check it. Another big contributor to hypertension is I see a lot of people taking naps here. It's called sleep apnea. I'm looking at people, and they're taking naps, and you're wondering, why are they sleeping during the day and they slept 6, 7, 8 hours during the night? It's because of sleep apnea. Oh, my husband snores a lot at night. I just kick him, and then he wakes up, he goes to bed, and then I can't sleep because he won't stop snoring. But you think that's just normal. Oh, that's what we tend to say, right? But that's a disease that contributes a lot to high blood pressure. And so if you're feeling tired, you rest at night, but during the day, when you're just sitting idle, you sleep. You need to go get checked for sleep apnea because that one can be contributing to high blood pressure. And with high blood pressure, the same thing that happens with diabetes, most people will have kidney failure. So end-stage renal disease is one thing. And a lot of women won't really know because you don't have symptoms. But for men, they'll come in and they're like, oh, I just pee and the stream is so small, or I have to wake up at night 1,000 times to go to the bathroom. Or, nyotaga likoishi. You get too thirsty and you're drinking a lot of water. These are things that we just say, oh, it's because, I'm drinking a lot of water, so I'm peeing a lot. I'm thirsty because I work night shift, so siku kunywa maji, but that's not the case. You need to go get screened for those kind of things. And one thing that I tell my patients about is diet, diet, diet. As we said, the ugali is good, the githeri is good. I love githeri, I love the samosa, nyama choma. Those contribute a lot. And then on top of that, kasumbe, you add that salt. Because nyama choma ni nini bila kachumbari na kasumbe hapo side. And that salt really, really affects your blood pressure. Normally, the recommended amount of salt is 2 grams. How many people here, by show of hands, actually read labels in everything that they buy? Albert and Mary, and then Samson. Only 3 people read labels. Because we tend to just think, and then the other thing, which I'm also very guilty of, you go buy a bag of chips. When you sit down, without that bag gone, hautaamuka hapo, you are not going to get up. That's what people do. You have to eat and make sure umeinamia everything. It's completely gone. Exactly. Or even you open the bag and lick that salt kenye kamebaki hapo chini. We are not reading labels. And that bag, it says serving size 10 servings in that container, but umekainamia all in one sitting. And you wonder how, and then you hear people say, I don't eat a lot. Of course you do not eat a lot, but actually the components of that bag, you just ate what 10 people should have eaten. That's what reading labels tell you. You go, when you put a thermos of tea hapo, you drink that gashai all night. Mpaka kaishe ndio uende ulale, then you go to bed. And honestly, you didn't measure how much milk you put in it. You just poured the milk, maybe even a whole gallon of milk, ukayeka kwa thermos, and you've been drinking it all day. And when you go read that label of that milk, when you take 1 cup, that's about 60 calories. And now you drank almost what? 20 cups from that 1 gallon? So you in one day, your caloric intake, let's say you're eating about a 2,000 calorie intake for that day. You drank 1 gallon of milk, that's 1,200. The only thing you can add up is skuma. And you're done with your calories for the day. But we don't do that. Exactly. And you know,
is that a confession?
And then on top of that, with that tea, you take a loaf of bread. And then uchukue the zesta. You know, we have lukinya and those things where we go by. Now ukule, you know, you on top of that, you add 3 sausages from Kenya. Breakfast, you're taking calories for your whole day. This is breakfast only. You haven't added your lunch and dinner and the in-betweens, you know? Exactly. When you're eating that cheeseburger from McDonald's, you're eating about 1,500 calories, and you haven't added the fries. Now I'm Kenyan, you know? If I'm ordering, I better get that soda. Why would I leave it and I'm paying for it? You know, my husband says all the time, why would I get the coffee in McDonald's is about $2? Why would I get the medium and the big and the large are the same amount of money? I'd rather get this big one. And that's the mentality. And that is called selling. You know? That's what those people who sell. You go there, you look at a yogurt. You're like, chupa kubwa. This one costs $2. This smaller one costs $1.88. Aye. For 12 cents, I will leave this big one and take the smaller one. Lord, let me take this big one. And then you make sure you drink all of it. When we have to put our health, I know sometimes it's really hard. But you have to understand that is the biggest, because they say those people who try to get abs like me say 80% is made in the kitchen. And that is very true, even in our health. As much as we want to increase our cardiovascular health, which is through exercise, because a lot of exercising is more of cardiovascular health, so your heart health. But everything else, a majority of it is about our diet. And that's why I'm putting a lot of emphasis on that. People don't tend to go get checked like labs, cholesterol labs. How many people know what their cholesterol is? 3, 4, 5. We have a lot of need in this community. And in this church, thank you, to talk about our health. Because when you are reading about like your cholesterol, what it is, and having it checked, I can tell you, when you get to know your numbers, and you see there's a problem, most people tend to change. But if you don't know, they tell you, what you don't know won't kill you. If you knew there was a snake here, trust me, you're not going to jump over the snake. You'll go around and go the other way. Is that true? But if you don't know, you just keep walking. And that's the same thing. If you know what your numbers are, Pastor, do you know what your number is? So that is the big thing. You need to know. You need to be aware. And you yourself have to be the one to take that first leap of taking your health in your own hands. We can come here and talk about it all day long, all night long. But without you taking that first step, we cannot help you. And that's the same thing with compliance that Dr. Beatrice is talking about. We can tell you all the good things about you taking metformin and you exercising and checking your blood pressure and your blood sugars. But if you're not doing it, it's not helpful. Every time I have a patient come in the office and they say, Dr. Monica, Dr. Mwangi, what do you think is the best thing to do? I tell them, the best thing is what you are going to do, not what I'm going to say. Because what you do is more important than what I tell you. And so at this point, it's for you guys to take your own health in your own hands. To start thinking about long-term effects of these things, because it might not affect you. And I know a lot of people come here and the biggest thing is, I want to be financially stable, I want to do this, I want to build back in Kenya so I can retire. Even Pastor said, what's the point of you retiring? You go sit down and then you're dead. You don't get to enjoy that. So you rather take care of your health at this point before it gets to that extent. Go ahead. Okay. And so for blood pressure cuffs, any drugstore, Walmart, Walgreens, those ones are available. And if you go to your primary care, you can always talk to them. There's also, in Walmart, you can go and sit down. There's those machines, the big machines that they tell you, they give you prompts. Put your hands in, sit down, relax. You keep doing that. You can check your blood pressure there. There's also A1Cs in Walmart. We were going to bring some, but we didn't get time this morning to go grab some to whoever wanted to screen themselves. And they're very simple. They're just like the blood sugar checks. You poke your finger. It's a very tiny needle, and then you put some blood, and it will tell you what your A1C is.
In 5 minutes.
Yes, in 5 minutes, you'll know what your A1C is. And so for those people who haven't seen a doctor, I know insurance can be another thing that a lot of people will be concerned about is insurance. But I can tell you, when you come to see me and you self-pay, maybe you'll get a bill of $150. But when you go to the hospital for that hypertension, $30,000 for being in the emergency room, or maybe 2 days, when they're trying to bring your blood sugar down. And so as much as we are trying to cost save, they say cheap is expensive. You might be trying to save. You don't want to go to the hospital at this time. And when you are broken, we call those people train wrecks. When you're coming as a train wreck and we're trying to save your arm, we're trying to save your legs, your kidneys, your head, your toes, that becomes very expensive in the long run. And we have a lot of community resources. Maybe I can just add before I finish. There's a lot of community resources. There's clinics such as SEMA, there's clinics, community health, where you can go for preventative services. And if you do not have insurance, they help you apply for state insurance. And another thing is, if you are an undocumented immigrant, we do not ask for your social. We do not ask, are you a citizen? Are you a green card holder? Are you a what? My job is not to do that. We are bound by some laws. We call them HIPAA. Unless the court gives me a document that I have to say, I actually saw you, Pastor Gitonga, and for me to release that information, I can never pass that information to anybody. And so sometimes people tend to be scared because they're undocumented, but unless the court requests it or asks for it, then your information is safe. And nobody will ask you if you're undocumented or not. We have to provide care regardless of your financial situations. And so if you feel like the biggest barrier is insurance, there are a lot of resources. There is Tacoma Free Clinic. In Tacoma, there's Olympia Free Clinic. I volunteered to Olympia Free Clinic, where you get providers who volunteer. So the doctors volunteer, and you go there and you don't get a bill. And they will do those screenings for you. And so those are resources that are available to us that a lot of people are not aware of. You can also, when you go to your clinic, doctors have a lot of social work connections and all that they can send you and refer you to. And so you shouldn't feel the need of not going there because you're scared that you're not going to have resources. And this is one of the best states where we have health resources, including mental health resources. I know Beatrice didn't talk about mental health, but that is another thing that is killing our Kenyan community, is mental health, because we burn ourselves out. You go from here, you're working, you have 30 minutes between this job and the other job. Your house, when you go back to your house, you're like, it's cold, it's freezing. The food that you bought 2 weeks ago, you're just going back to eat it. You know? And then you wonder why we have a lot of depression. We have a lot of anxiety. We have a lot of suicide rates here in our community. It's because we don't take care of ourselves. And like Dr. Beatrice say, you sit down and you just pass out. Because you're so exhausted, your body is telling you you need to rest. And I'm not telling people to be lazy. I'm not saying you don't work, but you need to have that balance. Because if you're not taking care of that body, it's not gonna take care of itself. At some point, it's going to give up on you. And so it's very, very important that from today, I hope one thing that you understood from this talk is that you need to take care of yourself and take that leap today. If you don't have a primary care doctor, just go find one. If you have insurance, they will have a list where you can go look for one. They will give you that information. And if you can't find one, I'll be happy to see you. And if not, you can just find me, and we'll find a way for you to see someone. We'll be able to provide those resources for you. Because the most important thing, other than us getting spiritually fed, is taking care of our bodies. Because I can tell you, I'll give an example of our pastor. If he is not fit, he will not come here and talk to us about God. You know? He won't be able to do that. And so even if we are trying to spread the word of God and trying to, talk about God, we also have to take care of that temple that belongs to God.
So the only other things that I wanted to kind of point out, because they do not come so commonly, but lung cancer screening. So it's highly unlikely that somebody still smokes here. I don't know anybody, but we all come from somewhere. If you have any history of smoking, and especially men, there's what we call the abdominal aortic aneurysm, can happen right around there. And pretty much comes with any sort of exposure to tobacco. So that is one of those clinics that are very uncommon, but when somebody gets that, it kills quickly. Literally, it's a 5-minute deal. So that is one of those. Lung cancer screening, I know, especially, I'm looking at all the older gentlemen here, during our youth or your youth, you did a lot. So if smoking was one of those things, God has already forgiven you, but please get checked, okay? You do not have to confess it to your pastor here. Another one is STD screening. This is one of those uncomfortable topics, but if you have had kids, I don't have to say it, but it's something that is naturally normal. That's why God created Adam and Eve, So we know it's something that happens. So let's not be shy about it. STDs are very common within our community now. Not so much in the older generation, but we also need to make sure that, in this church we have a lot of the older generation, but not the younger generation. So talk to your kids. Because I think recently there was super gonorrhea in Kenya. I don't know if you guys heard about it in the news. So it is something within our community, and that is also something that is screened when you come to the clinic. In addition to mental health, drugs is the other thing I want to bring in perspective here. I'm pretty sure almost everybody here knows somebody or have heard of somebody within the Kenyan community that uses some sort of drugs, and alcohol is actually the biggest one. We have lost quite a number of Kenyans, and especially young Kenyans, to road accidents. And the most contributing factor is almost always over-intoxication with alcohol. So that is also another topic that we need to especially approach our young people about. Because it's okay to have birthday parties, it's okay to have graduation parties, it's okay to have a glass of wine. I'll talk like a doctor, not as a pastor. It's okay to actually have a glass of wine, and it's actually okay to have a beer in medical terms, not according to your pastor. But let me put this, because I don't know what people are doing in their homes. If you're a woman, you should never have more than one alcoholic beverage in a day. Men, never more than two. Anytime, pardon?
When you say one, it doesn't mean go get a jug and say one. It means the little glass of wine.
Yes, so I see the cup right there. Yes, Dr. beat his cup. So anytime you're having more than is recommended, you're kind of crossing a medical red line, and that can cause a lot of issues. We know that, especially when it comes to things like DUIs. Drugs, we've heard about the fentanyl crisis. We've heard about the heroin crisis. And we hear it as something that just happens in the news, but Monica and I are clinicians, so we sit firsthand in the clinic when these people come to the clinic. And whenever we are going to these memorials, fundraisers for funerals, all we hear is, somebody, got drunk, or somebody just had an accident. We don't actually hear the backstory in terms of what else was there. We don't lift the rug. But drugs, they are leaping through our community and in a very, very, very bad way. So let's talk to our young people too in terms of addressing that particular topic.
Yes. And as parents, we need to stop demonizing people who have used drugs, people who use alcohol. You are the ones who are supposed to be at their support system. If you're my dad and I come and tell you, I was using alcohol, I was shooting heroin, don't start saying, Wagare, where, Uma, Odie. No. Because that is our first response that we tend to do as parents. And that's how you guys grew up, where I tell you something, you first of all smack me, and then now we have to talk about it. But then you're putting that barrier. Yeah. And now you're factory resetting even their mind. They will never tell you anything. You're putting a barrier between your kids and yourself. Instead of you being the guidance for them and saying, there's risks to this, how can I help you? We don't do that. And then we start complaining. Our kids don't talk to us anymore. But it's because we have not given them a safe space to come and talk to us about it. We first want to rebuke them, instead of giving them an open space where they will come and tell you, hey, this is what is going on and I'm struggling. The other thing is the trauma that comes with it. There's a lot of trauma that comes with that situation, because with everything, there's a reason why that person went to start using drugs. It could be not a very good reason. My friend just gave me to try and I felt good and then I kept doing it. That is a valid reason to them, you know? And so you just don't say, that's not a good reason why you started using drug. Instead of that, ask them, how can I help you? What can we do to help you get from that? Is it taking you to rehab? Can I help you? Maybe can you move to somewhere else where you don't have those friends? And so having that open door policy with your kids. And for us parents, especially I know like my parents, if I told them anything like that, oh, trust me, that night I'm not gonna sleep in that house. So we shouldn't be like that, you know? This is something that is affecting us here, and this is something that we have to accept that is going on. But what is your hand in trying to prevent that? You take those youths, sit them down and talk to them, and not just rebuking them and making them feel bad that they had to go through that. That is the same thing with depression, same thing with suicidal ideation. Because I have seen a lot of parents who say, you wanna kill yourself? Go ahead, try it. Let's see if you're going to do it. Just go do it, exactly. And then they commit suicide and you live with that guilt that if only I could do something about it. But it's too late. But this is not something that people tend to talk about in our community. And maybe before we ask for questions, the last thing that we'll do is we'll open up the floor to any questions. And before that, in the summer, we are planning on organizing just health fairs where we can do screenings for diabetes. We actually have on Saturday, I think I can send it to Pastor. We'll have somewhere where you can go get screened for diabetes and hypertension. I believe it's in Kent or February.
It's in Kent.
Yeah, yeah. It's open to the community. So if you feel like you want to come there, me and Dr. Mwangi will be there and we'll be doing those screenings for hypertension. So we'll be checking blood sugars and blood pressures for anybody who shows up free of charge. And then the last thing will be in the summer just trying to be starting now. It's not as cold as it used to. Because I know in Kenya, Pastor Gitonga ungekuwa the richest man because of this. We now want it here, not here. Sindio? Hey, let's try and because this is not healthy. This is not being rich. It doesn't mean you're rich. Before then, ilikuwa because you're rich. And then I know also we love meat. Pastor Simon, don't look at me like that. I'm being a doctor here. I'm being medical, and then the other one we'll talk about on the side. We love nyama choma. And the red meat, we also need to cut that because that also contributes to our unhealthy habits. Red meat is good, but you need to have moderation to it. And that's my parting shot.
Right, so just one last thing, sense of community. It's important, not just for substance abuse, but also for your own mental health. We talk about be your brother's keeper, and especially when it comes to these uncomfortable topics. If a person my age is going to get gonorrhea, I will probably know it before the parent. So if you find your friends that are involved in those high risk, talk to them. That goes for marriages, especially Monica mentioned about erectile dysfunction. If you're having a problem, go get checked. If your husband is not, take him to the clinic. So some of those things in terms of like, let's look out for each other. Okay? Questions?
No, I just wanted to ask, most of us as immigrants, either when we come around here, we are told go for TB test, and already we know the result. It will be positive. So what's the advice? How do we handle that?
And so for TB tests, a lot of people react differently. Let me say that. For example, I got the TB shot that we get in Kenya, but I don't test positive for the skin test. And so there are people who actually, until today, they do that. So if you know that your test comes back positive, even if your test comes back positive, they won't treat you. Do not agree to start treatment just because of a positive TB test. That's not a recommendation. The gold standard to do a TB test is sputum culture, which means they will have to do an X-ray, see if there is anything in your X-ray that indicate there is TB, and if there is anything, including your symptoms, not just that, including your symptoms as well. And then they'll do a sputum culture. If that comes back positive, then you'll start getting treatment for TB. Just because you have a positive, because with any single test, there's something we call specificity, and the other one is sensitivity. And so that just means specificity is just that. How specific is it in actually finding a true positive? But there's always a true negative or a false negative. So sometimes you might test positive because either you got the vaccination, or some people will just test that because the test was defective. So make sure that you get a TB chest X-ray, and you also do a sputum culture before you agree to do the treatments. And if you know that your test comes back positive, if you tell your doctor, they will not force you to get a skin test. There's another one that we do a blood test. It's called quantiferon. So that is another one that you can test instead of the skin test.
So generally, if you were born in Kenya, and particularly before 1995, there's a very good chance you got the BCG test. But I mean the vaccine, I would highly recommend go for either for the quantiferon or go for the X-ray.
Yeah.
Yes. Mm-hmm.
Thank you so much. This one is for you, Dr. Mwangi, the man. You talked about cholesterol level, and I'm not sure whether I heard clearly, but I wanted to know what is the normal cholesterol level, and does it matter with the age?
So that's a very loaded question. So of the basic cholesterols that we check, there's actually 4 different types of cholesterols. And I'll explain it this way. So to answer your question, the first question, what is a normal cholesterol level? Specifically talking about what we call the total cholesterol level, we like for it to be less than 200. So keep in mind, cholesterol is actually something your body needs, and it is important for your body. Too much of it is what is the problem. So total cholesterol less than 200 is considered to be normal. There is what we call the HDL cholesterol. Fancy term is the good cholesterol. So that when we actually want you to have too much of the good cholesterol, anything greater than 40 is considered good. And then there's the bad cholesterol. And that's the one that we want to keep as minimum as possible, generally less than 100. So to answer your question, 3 important types of cholesterol: total less than 200, good cholesterol as highest as you can get it, but mostly greater than 40, bad cholesterol less than 100. Now, age. Age matters a lot, especially for people who are greater than the age of 40. So when you come to the clinic, there is a number, we call it the cardiovascular risk number, that we can very accurately calculate for you to try estimate your risk of getting a heart attack or a stroke. Now, so let's say, for example, somebody in the ages of, let's say, like 55. If your cardiovascular risk is like 20%, then your cholesterol target is very different from a person of the same age with a cardiovascular risk of like 5%. Now, the things that go into that cardiovascular risk is, 1, your age, your gender, male or female, and your race, whether you are, they will usually use Hispanic or not. But other things, do you have diabetes? Do you smoke? Do you have hypertension? And of course, your cholesterol. So there is no specific box that everybody has to fit in. We individualized medicine based on the specific person and the specific risk factors. Mm-hmm.
And can you just mention, for the purpose of getting some information, what are the sources of like good cholesterol? Because sometimes you have this, yeah, like when you try this food, oh God, somebody says you can eat this.
So yes. So how many of you know the Mediterranean Sea? Any person ever heard of Mediterranean? Yes. So there is something we call the Mediterranean diet. So that's the one thing I want you to keep in mind. Go Google it at home and take a look at it. Mediterranean diet. So it also happens to be around the same place that Jesus spent most of his life, but it's a specific location that we have seen people to tend to live longer and tend to live more healthier. So the researchers actually went there to find out what these people are eating. So number one, a lot of these places, so for example, when it comes to the type of meat they eat, they're very less focused on beef, goat, and things like those ones. They usually actually focus on fish from the Mediterranean Sea, and they will supplement that with poultry, so that's chicken, turkey. So, for example, the question about meat, that is the biggest change you can make in that cut out the beef, cut out the pork, cut out the goat, and incorporate more fish and chicken. In terms of snacking, so those people do tend to eat a lot of nuts. So, macadamia nuts, cashew nuts, peanuts. So if you're going to snack, make those your regular snacks. Now, in terms of the biggest sources of carbohydrates, for example, rice is very common around the Mediterranean, but they'll focus more on the whole grain, not the white rice. So when the next time you go shopping, do not buy the white rice, actually go for the brown rice. If you are going to buy bread, do not buy your whole wheat bread. If you can be able to get the multigrain, that is even better, but not the white bread. Okay? If you are going to go get your ugali, simba, or I don't know, or bunge, so it's kind of the same thing. If it's white, avoid that. Go for the whole grain. And of course, the last component. Yeah, the last component of it is actually exercising. So, like Monica mentioned, a lot of your health is made in the kitchen, but there's still the 20%, and that will come mostly from the type of exercises that you do. And it does not really mean that you need to sign up for a gym membership or something like that. We all have a gym. It's called the sidewalk. Just get out and walk. Okay? Yes.
And for the older people, just to add on the exercising, you need something called moderate intensity exercise. So don't break your bones, but you need to bring your heart rate high enough to make it moderate intensity. And then weight training or strength training. You don't have to go to the gym and lift the weights, but you can take rubber bands and just do that. Because that is the other thing, that when you are senior over 65, you're at risk of breaking your bones. And that's what kills a lot of people who are older, because once you break your bone, that's where dementia attacks. It's like it brings everything up. And so just making sure that you're doing strength training, you're taking vitamin D and also vitamin C. And so and calcium as well to help with your bones, especially here in Washington where we don't get a lot of sun. Just taking vitamin D supplement and calcium together will help you with your bones. No, you can take it over the counter, but you just have to make sure that it has a third-party assessment that what you're buying in that supplement is actually what they have it. Because a lot of supplements are not really monitored by the FDA, so they can tell you they're giving you 2,000 units of vitamin D, but in fact it's only 200. So just reading and making sure that they have somebody else who assessed and made sure that what they're saying they're putting in there is what is in there. From the drugstore, yeah. It should say in the bottle that it's been assessed by a third party.
No. Somebody has a question.
So for the purpose of the supplements,
Back to drug addiction. Going back to drug addiction, especially here in Tacoma, we have a lot of it. I have two daughters who are addicts. It's not easy, and you never know, because when they go to school, especially in high school, that is where you get a lot of it, and you don't have to yell at, at them when you see them high. You got to know how to talk to them.
Yeah.
And it can be very, very expensive.
Yeah.
And you go through a lot because now here they have going on meth and weed and crack. And you never know what they are going to take because they are given by their friends when they are in high school.
Yeah.
I've had to deal with it for the last 5 years, having 2 daughters who are on drug addicts. They are addicts, so all the time going to the police, they are arrested, and you don't have to yell at them, you just need to talk to them and seek help from the police. The police will help you. Pias County Jail, I have a name there because my daughters have been going there. They had been arrested and taken to Pias County Jail, and it's very hard.
Yeah.
But all you have to do is to talk to your kids and pray to God every day.
Yeah.
Note that I did not know. As I retired as a detective chief inspector, so I was dealing with drug addicts. And the mother of my children is a criminal lawyer in Kenya. So we had to deal with all this. And it's not easy, but we are getting there with God. And I have told the pastor here and Dr. Beatrice, and I have also told Dr. Karogi, they know about it, and the church, those who have been praying with me, we are getting there. God is answering our prayer. I am here as an illegal immigrant, and it is very hard to get through to get some help. It's very hard sometimes, but by the grace of God, we are there, and everything is getting okay.
Yeah. All right. Thank you for sharing that. Yeah, it's a.
Also have another problem of prostate cancer. I don't know how that one I had to go through the biopsy about 3 months ago. So I don't understand about the BSA when you go through when they check your blood test.
Yeah.
I don't know how the BSA, what you should be checking.
And with PSA that he's talking about, that is a lab test that you get done. It's more of the risk versus benefit of doing it. Because PSAs are not very accurate in determining if you have prostate cancer or is it just a big prostate that you have. And so once that tests positive, with primary care, we'll send you to urology, you'll do a biopsy, and they'll see, is it just a swollen prostate or a bigger prostate, or is it prostate cancer? So, and that is part of the screening that we have here, that with that, anybody who has, and you also have, if you have symptoms. So it's something that we do in primary care. We do a PSA testing. If it comes back positive, then we send you to urology for that biopsy. So I think they did the right thing to do a biopsy on you.
And to add to that, the symptoms that we're talking about, especially in men, the biggest one is actually a problem with urinating. Like you feel like when you urinate, like it's not coming out the light, like the stream is very weak, or every, pardon?
Like you have UTI.
Yes, it's almost like you have UTI, or sometimes you feel like you have to go to the bathroom a lot of times. Those people tend to wake up multiple times during the night, but every time you go to pee, only a little bit of it comes out. So things like, if you have any of those symptoms, it's always a good idea to get checked. Yes.
Yeah.
We're going to have a minute for questions because you don't want to keep people long. People want to go to work. So, yeah.
Mine is on pressure curves.
the cuffs which we use to measure blood pressure. The ones I am wondering whether the ones used that which we buy from Walmart and such other places are calibrated the same as the ones which are used in the hospitals, because when you use the ones which are at home, the pressure is okay, but when you go to the hospital, the blood pressure is high. What's wrong?
So on that question is, the blood pressure machines come from different manufacturers, and what I always tell all my patients is, if you have a blood pressure cuff machine, when you come to the clinic, bring it with you. That way we can see if it is calibrated well or not. The greatest majority of them are. Some of them are not. And the other thing is, there's something we call white coat hypertension. It is a real thing where the blood pressure is actually fine at home. For whatever reason, when you see a doctor, it gets scared and the blood pressure shoots up high. Yeah. But even in the cases of white coat hypertension, that would be the benefit of bringing your blood pressure cuff with you, so that if you're still elevated in the clinic, if yours is calibrated accurately, you would also expect to get similar readings on yours at the clinic. Yeah.
The other thing is the technique of using those blood pressure cuffs. We have a small blood pressure cuff that you use at your wrist. There is a way you're supposed to put it. You can, my husband teaches me, you do this because it has to be at the level of the heart. If you put it right down there, it's going to be something else. If you lift your hand up, it's going to be something else. So the technique is very, very much important. There's a way we look at when I was a nurse. I forgot all of it. But there's a way we had to place somewhere along where the main artery is, so it can, artery or vein, whatever it is, that vessel. So sometimes you'll put it anywhere. It has a lot of effect on the proximity to the heart. So when you buy those blood pressure cuffs, one sin that we are all guilty of as a Kenyan, we do not read manuals, we don't read instructions. So you just get the cuff, you remove it, and you're I'm always asking my husband, how is it supposed to be done? He's read the manual. Thankfully, he can read for me. So please read the instructions of how you use those cuffs.
And preferably get one that goes here, if you can. That tends to be a little bit more accurate than the ones down here. But if you have to use the one here, make sure you follow instructions. Yeah.
And
making sure you're seated for at least 5 minutes. Just don't get your cuff and do your blood pressure. Do not cross your legs. You have to put your legs straight down, and you shouldn't be talking to anyone when you're checking your blood pressure.
I have another question. You talked of, I don't know how you talked of sleeping something.
Sleep apnea?
I discovered that when we are aging, and especially all the people from 70, you keep on sleeping, and when you sit, it starts connected within the blood pressure or something.
It could be. And there is multiple reasons that can lead to something like that. So sleep apnea is one out of many. But and this is why when you come to a primary care clinic, we look for a lot of things, not just sleep apnea. So for example, thyroid problem, low thyroid, will always make you feel tired. So anytime you sit there, you're going to fall asleep. Low vitamin D, that's pretty much what causes a lot of these cases in Western Washington, just because the vitamin D levels are very low, so you get tired all the time. And another one is anemia. Low iron in your blood will also make you feel fatigued, to make you feel sleepy. So sleep apnea is one out of about 5 different causes. So when you come to the clinic, we look for all of them.
So, meaning that when you are aging, you must be lacking one of those. Because I find even these old men from 75 to 80, they keep on dosing.
Yes, it is actually. Some of those are more common in older people. That is true. But it's more of a question on whether we're able to distinguish which is which by testing.
The other thing that could affect that is when the aging process and our brain and our routine. So when somebody is 70, for instance, we've been active all our lives. If my cousin here now from next year, he decides he has retired, he's not working anymore. The cycle and his body is changing. And he doesn't have something to wake up to rush to do. So he just tends to sit there because I have nothing to worry about. I'll just tend to sleep because there's nothing that is pushing me. The other thing is after working for so long, there's something we call the circadian cycle. It starts changing as we grow older. And what I've realized is that as people start getting older, they start knowing melatonin, trazodone, Benadryl, those kind of a thing, because there's a life process that is happening. Now let me put this in our population. And now, please don't hate me. Let me because I know I'm guilty of the same. We work in healthcare, right? How many? People are free now to lift their hands. I'm right there. How many work shifts? Okay, sometimes you're working during the day, sometimes in the afternoon, sometimes at night, sometimes you don't know whether you are working or you're not working, sometimes you're not sleeping. I worked night shift for 12 years. Today, I'll have no problem staying up for 24 hours, but it's a struggle every single day in the morning by 9 a.m. to be awake when I'm having my first client. I'm like, I have to be awake. My circadian cycle changed because of the work progress. I don't want to ask how many are working in an adult family home. Now, there's something that we call sleeping and resting. Okay? There's that one which is like, it is 9 p.m., I have to close my eyes because my body is going to give up on me. But now I'm working here 7 days, and I have 3 or 4 or 5 clients, and I'm sleeping, but I'm still working. Does that make sense? So are you actually sleeping? No, you are sleeping, but you're not resting. Because you're sleeping, but your mind is listening. If that kagegere goes, you have to jump. Because if my boss comes and finds out the client fell at night and I did not go to see them, do you see how guilty we are? Because I'm also an employer on that. So that can contribute a lot. Because you are in bed, putting the body to sleep, but your mind is not asleep. It is halfway asleep, halfway awake because you're still working. So there are so many factors that contribute to sleep, especially with advanced age.
And one other thing is, you mentioned something about age. There is a reason why people retire at a certain age. So by the time you're hitting 70, your body is not really going to handle the same amount of workload as a younger person. So if you're 70 and still having a full-time job, working double shift, of course your body is going to be a whole lot more tired than a younger person doing the exact same job. That's another part of it. Yeah. And
yeah, I want to ask about. I have my friend who was telling me that during the day, she's okay, working, walking, doing everything. But during the night, when she goes to bed or when she goes to sleep, she starts having a pain on one of the legs. And then she experiences some pains during the night. When she wakes up in the morning, it's hard to walk. He feels like there is some kind of pressure, like if the leg is full, it's pressed. But when now she starts walking again, now the problem disappears, no pain during the day.
Does your friend work in healthcare?
Yeah?
Does your friend work in healthcare?
Yeah, in adult family.
So there is a condition, we call it, the medical term for it is lumbar spondylosis, nerve compression to your back right here. So she is fine because in the position of standing, the nerve is not being compressed. The moment she lays down, it squeezes on the nerve that goes down the leg. So she will have that pain, and because it's a nerve compression, she's going to have that pain when she's laying down. As soon as she gets moving, she relieves the pressure from that nerve and she's fine. Yeah. So no problem. And I know you might want to ask how we treat conditions like those ones. And surprisingly, physical massage therapy tends to be the most effective. It's pretty much just relieving pressure from the nerve.
But she says, I have no problem during the day. I can walk, I can work, I
Yes.
can do everything. So she feels
The
no
best
need
thing,
of thinking to
the
do
best
this.
thing for saving that, because that sounds like very specific. It could be 1,000,001 reasons. Could be less stress, like could be maybe they got injured. So when it is very specific, that is when we are saying go see the doctor and have a full analysis. It could be that what doctor is saying, it could be something major. So if anything, it's very specific, please see them in person. You are blessed to have them right here. They may not be able to prescribe for you, but they know how to help you and to direct you.
I'm 85, and I've noticed an extreme change in my sleeping habits. I can't sleep at night, so I sleep during the day. Should I be concerned about that?
Yes, it's abnormal. Go see a doctor. There could be a lot of things that are causing the symptoms to go that way. There is so many reasons that can cause your symptoms to look the way they are looking, and that is something that would have to individually look at the clinic to pinpoint the problem. Yeah.
I think looks like we are done. Good. I don't want to ask whether there's any other question, because I'm sure there's going to be. Did you appreciate? Did you get anything? Who is going to volunteer one thing they got? Say one thing that you got. Because it could be very dangerous. Did you get it? Okay, yes. Checkups, okay? From the back there, yes, my Garana. Which is the best diet? I thought that's what you are going to say, because, my friend, we are going Mediterranean now. That's it, right? Yeah. So if he comes not very happy because he's eating Mediterranean diet, so that is where we are headed to. Monica is saying something. What else did you all get? Okay, men go for checkup. Cars go to Bishop Chacha. You won't need to come and see us. What did you say? You are not rich, my friend. Yes, please. Read the manual. That one, me, I've run that one. I have to.
And food labels.
Food labels, yeah. And understand what those percentages say, and the servings of chips, 10 in one sitting. In that corner, did we get anything there? Yes? Vaccinations. Guy, me, I don't get that flu vaccine. How many are guilty of that? These are things I hear all the time. I'm like, did you get? Nah.
I think Dr. Monica mentioned about eating food that has been in the fridge for long.
Yeah, people are starting to have the confession. Food that has been in the fridge for long, you know what happens? Those are extreme temperatures. Sometimes we do this. We buy them, we cook, we freeze. We get them from the freezer, we recook, we refrigerate. So by the end of the day, you're eating some few organisms. Before I forget, there's something I wanted to say. When you talked about the supplements, about the verification of whatever. There is a company that I looked up and I really like their supplements. So instead of you going to read and you're confused, it's called Centrum. 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 That at least now have made your work easier. So just go to the pharmacy, Costco, Walgreens, it's expensive. The problem with us, we work so hard, but we're even very mean to ourselves, not only to God, even to ourselves. We want to buy the cheapest for your body. But you want to go and build a mansion for 6 million in Nairobi where somebody else enjoys when you sleep, where you know you sleep, and then you take the cheapest supplement. I'm disappointed. Please, appreciate yourself.
And if you have a yard, plant a garden. Food from your own garden is always going to be better than the one from the store. Yeah.
How many have yards? Like how many owns a home? Guy, you are the motivator. How many owns a home? So I'm going to be inspecting. We are going to be inspecting. This one, we are going to follow them. Make sure you have the kitchen garden. You can plant on those. Go get that thing from Home Depot. The box, the moharati. Put the soil. Plant your sukuma and nyanyas there. So we are going to be doing that this summer. Parting shot, Dr. Riz?
Yes, so thank you so much for having us. If there is any other questions, we can answer them for you. The things that we talked about today, keep in mind, they are not just for you, but also for other people that look up to you. So make the changes and influence somebody else to also make those positive changes.
You mentioned that your clinic is somewhere close to the church, but you did not specify.
Yes, so my clinic, I work for Franciscan Medical Clinic in Spanaway, 2 minutes right here. The address is 144 169th Street South, and that is Spanaway.
But you cannot just walk in and say, I want to see Dr. Mwangi.
No, you actually have to make an appointment. You do need an appointment to see me. You can either make
You have to register in that organization, then you become a patient there. So it's a process.
Yes.
Yeah.
For me, I think I've talked a lot, but my parting shot will be, Sister Anne.
Yes.
You make an appointment, you come to the clinic. As soon as we see you within the clinic on your very first appointment, that is sufficient for us to become your primary care providers. But you do need your initial appointment at the clinic. And that's all it takes, it's just your first appointment.
Okay, for me, as I was saying, is taking care of yourselves. Go get those screenings done. The women, mammogram, pap smears. For men specifically, you can get your prostate cancer checked. You can also have colonoscopies. I'm saying colonoscopy because I know a lot of you guys have not done the colonoscopy.
We get you, Dr. now. We get you.
And Dr. Beatrice is one of them.
Hey.
So we start with her.
Okay, I will. I will go and I'll come and tell you.
Supplements, getting your blood work checked. Yeah.
Thank you.
All right, thank you.
How do you appreciate all that information? All that for free. And more will be coming. Now, the next one we have. Sure.
And we are planning on, if we get a chance from you, having specifically a session where we'll bring the A1C machines, and if you're willing, we can check you for blood pressure and A1C. So we'll just make a date for that, probably one of the Sundays, and we'll be sitting anybody who comes maybe somewhere there because of privacy, and then we'll be checking your A1C and hypertension because some people don't want to go to the doctors. And that will probably be the first step, at least, that we can give to this community.
Yani mpaka you are being given free things, free services. Hey, Jesus.